Good morning on this spring morning. It's Tuesday morning. Luke's getting all cleaned up. Just got a bath. It's 7:16. We're getting ready to leave to go to the hospital for Luke to get some dental work done. They're gonna do it in the hospital. The pediatric dentist prefers to go to the hospital. Luke's got quite a bit of work to get done in his teeth. Some on his upper and lower molars. No one likes to get their fingernails cut in this house. Like no one. What little boy doesn't have dirt in his nails? You were playing out in the sand yesterday, weren't you? In the sand pit.
Okay. I was trying to dig
You need to soak their nails for like ever to get all the dirt out. They said make sure he's clean, no dirt in his nails, and he's washed up. We're finally at the hospital. That was like an hour, or it was just under an hour to get here. We gotta go where this pediatric dentist works. He has an office close up here by this hospital, but then an office like only 20 minutes from us. So he has two offices, but we gotta go to his hospital. All right, we're here. Luke's going in. Are you nervous a little bit? No. Mommy's nervous. All right, here's Luke's before. Okay, here's what's going on with Luke. He has super thin teeth and very little enamel. And so he's very prone to cavities. He brushes his teeth. We do our best, but he still has gotten some decay and cavities on his upper and lower teeth in the back.
While that's cooking, go ahead and check his armband for me, Dad. Make sure his name's spelled correctly on there, first name, last name. Yep. You can watch up here on the screen, look. Look up here. Your finger, that you got that little clip, that's making that wave for me. See it? So let's see, and then, yeah. Now it's gonna give you a hug. Okay, so just relax this arm, just like that for me, okay? See your little wave you're making? That's what that's making, a little wave for me. Look at that. You got 100. Look. You got 100 on your wave. Wow. Cool. He's perfect.
All right, Luke. He is going to use the restroom, and we gotta put this little gown on. Look, your gown has little cats and dogs on it. That's cute. And yeah, so she said you can leave your pants on, but just take your shirt off and your shoes. All right, look at that getup. There he goes.
You're bigger than patient Luke.
Patient Luke. Miley would be like loving to come here and see all this doctor stuff. Too bad we couldn't bring Miley. She would be so entertained. Miley loves doctor kits. She said, the nurse said that Luke gets to take this home for Miley to use. That's cool. Right, we're all checked in. Luke's all cozy with his cute little cat and dog gown. He's on the iPad. They're bringing him in a little kitty cocktail, they call it, to start calming him down, which he's pretty calm. I don't know if that brain is racing in there, but his outward appearance seems pretty calm. He didn't want to talk to the nurse. I don't think he said one word to her. Are you not going to talk to me now?
He's operating on his hot dog.
Oh, what game are you playing? Daddy got a new iPad. And so what a perfect thing to bring just to kind of keep you occupied.
It says he's a Christian.
What does your armband say? Let's see.
my bath.
Luke
Let me wash
Ryan.
my hair with shampoo. Oh no, the water is finished.
Look it
My
says
water
you're a
is totally
Christian.
finished. I'm in trouble. What should I do now? Hey, Mom.
I love that.
Mom.
Dr. Tyree is his doctor. Miss Barb is your nurse. All right, so they tell us that this is our waiting room. And it's just funny to see, like, well, not funny, but like, how interesting to see how all kids like react or do their thing. Luke's never been like in a hospital setting, except for when he was born and hung out in the hospital with mommy. So this is like, he watches shows on TV and he's got doctor kits and they play doctor at home, like with his sister. But he's just kind of like not talking to us. Peekaboo. I got a smile. He's just like trying to stay calm and he's doing really good. I'm proud of you, Luke. All right, update. After 30 minutes, we've been waiting here. Maybe over 30 minutes. We're waiting on the doctor. Dr. Tyree schedules these dental surgeries like every Monday or Tuesdays and Thursdays, I think they said, just to get them all done. So that's like his day of surgery. He's in his offices every other day, on all the other days, like seeing the patients, and then on Tuesdays and Thursdays, he does things like this. He'll come and do surgeries for all the kids that need it, that need dental work. So that's cool. He kind of has it like scheduled. It took us forever to get this appointment, or get to this appointment. They scheduled us way far out. The doctor has his little system going, like this room is literally like mainly used for the waiting area for his dental patients, dental surgery patients. It's nice to just be calm though sometimes, isn't it? It's very rare that we're just sitting in a calm place like this. I mean, we're kind of nervous, but we're like calm too. There's not like craziness going on all around us. Are you gonna try to find something on the TV now? What did you say, Luke? What did you say? Say it out loud.
I'm bored.
Hi, Mr. Board. We have this thing. He gets so mad. Whenever the kids say, I'm bored, I'm like, oh, your name's Board? Hi, Mr. Board. Our saying at home when they say, I'm bored is, the work of the Lord is not being done if you're bored, because there's always something that we can do. We could play a game.
How?
I don't know. Tic-tac-toe.
No.
Let me see if I have a pen. That would be fun.
How we play tic-tac-toe.
You're getting good at it. I saw you. You're like understanding the game and you're really getting good at it. Look, I brought some books.
Okay, let's figure it out.
It's day 2 or book 2. We're on book 2 from the Freedom Island series. I've been reading them. I've started reading them to the kids. All right, so let's do. Guess what? We already read book 1, and you're gonna know this book before Nolan and Miley. So let's read it.
I think. Where's the big oak?
Oh, this is a different story. Okay, this is called The Island of Free Ice Cream. This is gonna be interesting.
Mom, where's the big oak tree?
That's not. It's
No,
it's a
the
totally.
map. No,
Oh, the map. No, let's look at it.
that's the big oak tree. Is it?
Sky tree, it says.
Where?
No, you had to go Whiggamore Woods. There's the big tree
That's,
in Whiggamore Woods.
that's the big oak tree.
Yeah,
But,
these books are awesome.
Wow. It's the part where we did the puzzle. It's the puzzle. The puzzle. That's the
puzzle one.
puzzle.
Freedom Island books. We already read Little Lives Matter. This one, that was the first book. We're in Saga 1, and now we're on book 2. And this is special because Luke gets to hear the book before Miley and Nolan. All right, let's start it. Island of free ice cream. Rushington was the happiest city in all of Whittemore Woods.
Okay, skip.
No, we're outside of the woods now. We're in a city. We were in Whittemore Woods, and now we're going to a city. It hopped and popped, whizzed and whirled, buzzed and bounced with all kind of animals. The busiest spot of all was Rushington Market. Here it is. You poor little animals. The wolf snarled, your market isn't fair. You all work so hard, but Asher has the biggest booth. These wolves are trying to make others jealous of Asher because he sells the most and does the most and has the biggest booth to sell things. So they're trying to stir the pot and get people to be jealous when everybody was fine and happy. But now they came along and trying to make them jealous. Did you know that? Have you ever known someone like that?
No.
Someone that comes along to ruin it and make you jealous when you were perfectly fine and innocent? I know someone who does that.
Yeah.
The devil.
You're okay? Yes? Or you want mommy to do it?
It'll be okay.
It'll be okay. Go ahead.
It's just your
Yeah,
medicine.
okay.
Yeah.
Yeah, okay. Good job. I'm going to shoot it in and you swallow real quick. Swallow. Swallow it real quick and I'll give you water. Swallow it. Don't spit. Swallow it. Good
The bad
job.
tasting bud.
Did you swallow it? Does it taste icky? Okay. Don't do that. I'm going to give you water. Don't wipe it in your
No,
gown.
Spit it out.
I'm going to give you a sip of water.
okay.
I'm
Don't
gonna
wipe
just
it,
gonna
don't
give
wipe it,
you-
you gotta
Don't
keep that
wipe it.
clean.
I'm going to give you a sip of water.
You're
Yeah,
okay.
keep
You
that
swallowed it. Good.
He did.
You swallowed it. Good. buddy.
Great.
Don't keep that clean. Don't do it.
Yeah, this stays clean, buddy. Don't put it in your mouth.
We gotta do it. Okay.
Luke, stop.
Okay, here's your little...
All right, so Luke took his little medicine to start calming him down. She said in about 10 minutes, you're going to start maybe calming down a little bit, like getting drowsy and sleepy. And then they'll be able to he'll be more prepared for the full anesthesia by taking what he just took. So, he'll be good. And I just was telling him that Mommy and Daddy have been praying over this and we're in tune with things, and we ask God, like, if this is not something that we should do with you, if this surgery is not necessary, whatever, because God knows best. We prayed about it, and we want to be in tune with that and listen. And I had peace. I have peace about this. Do you want Mommy to pray with you?
No.
Really quickly?
No.
One more time?
No.
I think we should.
No.
Dear Jesus, thank you so much for this day. Thank you for Luke, and that he is just a part of our life, and we're so blessed to have him in our life. And help Luke not to be scared, and know that everything is okay, and that Mommy and Daddy are going to be right here waiting for him, and that we're in tune with you, and we've been praying. And I've been praying a lot, making sure. What was the show that came on? Luke watched a really special show that like kind of helped him. Daniel Tiger goes to the doctor or the hospital to have something done. Oh, he was getting his ears, either his tonsils out or his ears. Are you getting drowsy? You're faking.
Look at Mom.
It hasn't been 10 minutes yet.
Look at Mom.
Are you looking at old pictures?
You're on Mommy's belly right there. Oh, that went away. Hold on.
You getting...
You know why?
doctor's
Did you get the
in.
medicine okay?
He did. He already got his, whatever they call that, the juice.
Thursday. Let's go sit you back and take a quick peek in here. Like this. Chin up for me. Show me your teeth. Okay. All right, I'm the guy gonna be driving the boat here. This goes around the face just like this.
Yep.
Nose is here, chin is here, lower jaw. What we have to remember is even at his age, we have teeth along this line. That's where the food goes.
Yes.
That's where you chew. Below, these are developing adult tooth buds. Here's a 6-year molar. When it gets up to this line, you see it in the mouth, so it's not there yet. 6-year molar here. Dad, this is a 12-year molar. It takes 12 years for this tooth to get made up to here. You know, it takes 9 months for a baby. It takes 12 years for a 12-year molar. If we had wisdom teeth, and I don't see any hint of them right now, they would be up in here someplace, kind of as a dark shadow.
Gotcha.
The fact it's not there yet leans towards never having any, but he could. Doesn't make any difference. Now, let's look at a tooth. Let's look at a normal. Here's a baby tooth here. 2 legs, the chewing surface. You see that shadow right there?
Mm-hmm.
It's a big cavity in between the teeth. Compare that to this one over here, the X on it. See how it's all gutted out. This tooth
Are you looking though?
has to go. That's lower left side.
Yep.
Same thing, upper right side. That's got to go.
Okay.
The teeth with the check marks. He's 6 years old. These teeth got to last till about age 12. A big cavity, and a big cavity is really one I can see on this X-ray. That needs to be fixed with a stainless steel cap.
Okay.
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 So
If you do a filling, it's not going to last.
it's not.
It's
Yeah.
not- so let's do it the right way. The only toss-up you got. What do you want to do? He's a little bit behind, maybe. He's 6 now, right?
Yes.
6.5.
Well, he turned 6 in February.
February.
26.
Okay, so he's 6 years and 2 months. 3 months.
Yes.
Let's see what it
He's a little bit pokey as far as getting teeth. Now,
Okay.
a lot of his peers, his buddies, some are probably missing teeth already.
Yeah.
Yep.
His
Well,
are not
they were
gonna-
late, and all my kids were late.
And he's
yeah.
going to be late then losing those. So he
Oh,
may
yeah,
have
sure.
another year and a half. There's an option. You could put a white bonded cap on them. You would get some type of insurance coverage. As long as they're not hurting, there's no infection on the X-ray. I don't care. There's no bad
I mean,
decision.
what do you think?
Yeah, if they're not rotted, I don't want.
Well, I mean, there's
There's
decay
some
there.
decay.
But-
yeah.
but the
if the
decay-
cavity's not too bad, then
The decay is not going to spread to the other teeth. That's an old wives' tale.
Okay.
Okay.
So we just need to just keep up on make sure, he's doing his part at home with his
once
dental.
the decay starts, it's hard to slow it down or up.
Well,
or can you?
Those are going to be gone before they hurt him.
Can I ask you, what do you think of that Sensodyne stuff? Do you recommend that? I've already been using it on those fronts.
It
like,
won't make any difference for
it's
him.
not really
That's
doing
really
it.
made for adults that have gum disease.
But well, there was stuff where it said it helps with helps with stopping the decay. Is
I don't
that
think
even
so.
a thing?
Decay
Or-
doesn't stop.
Okay. So
It only gets bigger. It gets bigger quicker if it's not clean or if there's too much sugar in the diet, but it does not stop.
I'm just buying more
Yeah.
expensive toothpaste is what I'm
Exactly.
saying, and I'm just
Quit-
wondering
quit
what
wasting
you.
your money.
Okay, that's what I wanted to know.
Has he been
Well,
having
much
toothache?
more.
Okay. Yeah.
So leave the front teeth alone.
Okay. Yeah. That's fine. We're just gonna continue to do our part to
Because
keep them
basically,
clean.
once you-
Okay, all right, we'll take
You want,
very good care of
you
them,
want
okay?
purple or green balloon today?
You want a purple or green balloon? Which one?
Good.
Yay!
We got a special on green balloons today.
He
Let's go find
he
one.
answered him.
Okay?
Did you do flip your sock around?
Oh,
Yeah.
I did that.
Oh.
I
that's
forgot
fine.
post socks
Oh,
on there.
Oh, that's okay.
We're just getting ready.
Gotcha, that's fine.
All right, let's
Okay,
go,
guys,
little man.
take a little nap. We'll wake you up.
Okay.
All right. All right, Lukey.
Love you.
We're gonna be right here, okay? Waiting for you. We love you.
Love you now.
Is he supposed to be like in there by himself?
Yeah.
I'm
Surgery room, you can't go in there.
I'm
They're
sad.
gonna gas. You can tell him just working because he's just starting to have anxiety.
Okay, well, I hope he's okay, but Luke is a very clingy kid. This is not like in his thing to just be whisked away from his parents. They're gonna like give him the anesthesia right away and start gassing him. So yeah. Where's the clock?
10:49.
What? All right, so look, we just got this message. It's at 10:47. It's 10:49 right now. It says the patient's procedure will be starting soon. We will notify you when it's complete. That's cool. We get it like on. They're like keeping us up to date. Look at Dave, like all getting all comfy here.
She text you.
I'm gonna see. All right, we're just waiting. He said it was probably going to be about 45 minutes. So, yeah, just waiting. Okay. It was around the exact time the doctor said. It was about 45 minutes. He just came in here and let us know that everything went really good and Luke is waking up a little bit. And so they keep him back there until he wakes up a little bit more. Oh, Dave just got the text actually saying,
So the patient's now
the patient is now out of recovery. We will notify you with updates.
11:20, so this 10:47, 11:20, so yeah, 37 minutes. He's around 40 minutes basically.
Yeah, like right at 40 minutes. That was really good. So yeah, the doctor just came in, talked to us, told us that it went good. He got everything done that he needed to get done in his mouth. He capped, like, he took 2 teeth out because they were just too, like, far gone. And then how many did he say he capped? 3, I think. Isn't that awful? All those teeth that he needed work on. But they kind of they just kind of monitor him as he's waking up. And they made a joke and said as soon as he starts fussing and crying, they're going to bring him to us. So, but he was just joking. Hopefully Luke won't give him a hard time. I don't think he will. But I want to see him. He'll be coming in shortly. And he can eat soft foods. So we'll see what Luke feels like because he hasn't eaten anything and he's going to probably be hungry. Or maybe he won't. I don't know.
You should be so
Luke is back.
proud of him.
Oh,
He did so good.
we need to be so proud. Hi, Luke.
Hey, buddy.
Still a little...
Answers when he wants to. Is he shy?
Yeah, when he gets nervous, he just kind of shuts down.
Yeah, I finally got him to say he ate a whole popsicle already, but he told me no to juice, no to water, no to another one. So I don't know if he's just not ready or he just doesn't want to talk to me anymore.
Yeah, he was probably ready to come back to us, right, buddy? All right, Luke's in his recovery zone,
When I touch it.
and he's just like coming back. He's already kind of back. He was letting me know. I just picked him up and gave him a big hug. He was letting me know that he remembers them putting the needle, the IV, in his hand. Luke is so groggy. I was laying with him. I laid with you for probably like a half an hour, and it was so nice just to snuggle with you, Luke.
You're snoring.
Yeah, actually you did. You started to snore. In my bag. So we are getting him dressed, and he's slowly, like, he was awake a little bit when he came in, and then me and him just laid down together. I actually fell asleep too. We fell asleep snuggling. And now he's having kind of a hard time. The nurse came in, did his vitals, checked him. It's all good.
I'm going to take your gown off.
He's released, and we're waiting for someone to come help us be escorted out. We're going to go home now. Okay? They said that he can have soft foods. He had a popsicle, and we stopped it just before we fell asleep again because he said that it was like hurting. So I'm like, no, do not like have any more of that popsicle because I don't want anything stirred up in there. And when he gets home, he's going to have some ibuprofen. He's still on the numbness now, and they gave him fentanyl and all of that. So that's going to take a little bit to wear off, but I want to give him the ibuprofen before it wears off, to get it going. He's like been checking in his mouth because it feels weird and different, and the crowns are tight. Can I see in your mouth? Can I take a peek? Let's take a look. Open real wide. Okay, there's the tooth that got pulled, and then this tooth on this side. There's a crown in there.
Hello.
Oh, cool, dude.
All right.
All right, Luke. You did good. Bye, room. Here goes Luke.
Going out to that main.
Okay, we're back in our neck of the woods, I call it, in our town. And Dave went into Aldi's. He's in Aldi's there. Dave went into to get Luke some soft foods. We ate. We stopped. Luke fell asleep. Luke fell asleep the whole ride home. He just woke up. Daddy's in there getting him some soft foods. Are you looking at your teeth in here? Dave and I stopped at Potbelly's on the way home and grabbed a sandwich just to eat in the car. Luke has been sleeping the whole way home, and he woke up and here, let me see. Look what you did. Come here. He woke up and saw this on my lap, a cookie from Potbelly's. And he's like, ooh, and he grabbed it right away. But now he's like feeling something in his mouth that doesn't feel good. And I just looked in there, and it was like a piece of gum where one of the tooth has been extracted. His gum, there's like a gummy piece of tissue like left there, and he's been like playing with it. So I remember when I lost my teeth when I was younger, I remember it would be like stuff would be left there, and then eventually it would just go away. Oh, there's Daddy. Look what Dad got you. Oh, yum. Yogurts, Go-Gurts, and this thing. This is what he wanted. Look at the Oreo thing. They had it. And this right here is right where we want to be. Home, snuggling on the couch.
I saw
We
my
had-
puke.
Oh,
I saw it.
you swallowed some puke? Well, in the car, we had a little mishap. He puked everywhere. Like, all over the grocery bags. It just spewed out. He was just literally like sitting there, like fine. We gave him a Go-Gurt, which we probably should have waited. What are the things called that Grandma gave?
It was Charlilo. That was a song.
Try Lilo. No, they're not. Wait, what are they called? We gave him a Danimal in the car.
No, Charlilo.
No. Are you okay, Luke?
Charlilo!
Luke. They're called Danimals.
No, it's in Chinese voice.
Oh,
Charlilo.
okay. All right.
Charlilo.
Well, we gave him a Danimal to sip on just because he was getting hungry. He ate my cookie.
Charlilo.
And Dave stopped and got him some ibuprofen as well. And I just gave him the ibuprofen. He sipped on a Daminal, and he was just sitting there. And all of a sudden, it all just comes out like that. And they said that is to be expected because of the anesthesia. Your stomach is all, and all the medicine that he had fentanyl and everything. So all of that is like wearing off a little bit. And he just told me a minute ago that it is starting to hurt a little bit. So I know what tooth pain is because I had my wisdom teeth pulled, and when the medicine wore off, it was something. It was painful. Maybe yours won't be that bad. No, you got ibuprofen in you, and we're gonna keep given it to you. It should last, the longest the pain should last should be like 2 days. Gums heal so fast. I wouldn't even say it would be a full 2 days. You're gonna be okay. Luke has slowly gotten back to himself. Here he is. He's been outside with Daddy working on the boat.
Broke it.
He's getting his fishing stuff ready.
I broke it.
But he is on some ibuprofen right now.
I think
So I'm telling him, hey, listen, Bubs, don't. Oh, you dropped it.
I broke it.
No, you didn't break it.
No, what the heck is this?
Oh, the hook's just, yeah, be really careful with that.
What is that?
It's twisted around there a little bit. We'll get it. It's like a little bit twisted. We'll get it. Just be very careful. You're not supposed to be, the doctor said you shouldn't be jarring around and bouncing around and moving around. So just make sure you're not doing that, okay?
It's like fake.
Wow, actually, Luke, your fishing pole is like magnificently awesome.
I know.
I love the
casket.
cork. I love the cork handle. It just looks cool. I like it.
I know I like casket.
Not in here. Next morning, and here's an update on Luke. He is doing wonderful. Actually, way better than what I thought you were going to do, Luke. I thought you were going to be in so much more pain. But he is a trooper. He's awesome. It's just me and Luke here. It's been so quiet. He's actually been FaceTiming his brothers, and it's so cute because I think you miss them, don't you? Do you miss Nolan? Do you want to go to see Nolan?
No.
Well, I miss them. I'm ready to go get them. They weren't actually, we didn't have it in the plans that they were going to spend the night again, but we just came home because we were thinking we didn't know how Luke was going to do, so we wanted to, then he puked on the way home yesterday, so we got him home. We needed to clean him up. We thought he was going to take a nap or whatever, but he didn't. He got like a second wind. Him and DJ actually took a walk down by the creek, and then I joined them. And he did go to bed early though, but he slept really good. That you didn't wake up through the night or nothing. And the doctor actually told us that probably during the night he might start bleeding again quite a bit, and there was no blood. So he's doing really well. And yeah, I'm happy that everything, all the crud is cleaned out of there. There's no bacteria lingering. He got all cleaned up. The teeth pulled that were just not salvageable. And then the ones that were a little bit salvageable got capped. And so I'm happy. I'm happy with how it all went. And I'm happy with our doctor and everything. All right, we're going to end this video here. Thanks for watching. We'll see you in the next one.